Hey y'all, Kayla Mowdy, Doctor of Physical Therapy, here for another Monday educational moment. This week we will continue our series in pelvic health. The last 2 weeks we've covered bowel and bladder, and now this week we will cover the pelvic floor's contribution to supporting the pelvic organs. I'm actually going to include a little pregnancy information as well because the uterus where the baby is carried is a pelvic floor organ. So there are three things that kind of sit in this little basket of pelvic floor organs. They are the bladder, the uterus for women, and then for men, the prostate is also there with the bladder, and then the bowels. So the rectum, which is the terminal branch of the colon and all of the digestive system. So all of that sits in those organs. The bladder is a holding vessel, so it can hold up to 16 ounces of urine or however you've trained your bladder to hold. And then you have the uterus in the woman, and this organ can hold a baby. So it can grow a baby and all the fluids and things necessary for that. So that is why the return of the Kegel usually happens in pregnancy. So a lot of people are like, oh, you're pregnant, do your Kegels. You should do these throughout life, not just when you're pregnant, but they're especially important when you're pregnant because there is that extra stress and that extra weight and extra space taken up in that region of the pelvic floor. So it is important that you activate those muscles and keep them strong. The pelvic floor muscles do not help with delivery. Some people say that in pregnancy you are doing those Kegels so that you will have an easier delivery, so those muscles will help with delivery. They actually need to relax during delivery and allow the baby out. And then if they were strong before delivery, they bounce back quicker. So that's what people mean by you'll have an easier delivery, is really you will have an easier recovery from a vaginal birth delivery if those muscles are in good shape before delivery. And then the rectum is important. A lot of times in this pelvic organ support system, when something goes wrong, when somebody has something going on with their colon, or they have diverticulitis or irritable bowel syndrome or Crohn's disease, we see dysfunction in these muscles because they're either always held tense or they're weak. There's some sort of combination where the strength and the length is not optimal for them to function properly. They get irritated. There's also hemorrhoids that happen in some people who strain during bowel movements or other things. So the pelvic floor is important to prevent hemorrhoids, keep everything in place. In a woman, a lot of times, as we get older, the doctors, for some medical reason, need to take out the uterus, and then there is a space in there, and they actually just tack the vaginal canal up to some other structure that the doctor feels is the strongest to keep things in place. But sometimes that doesn't always work out so well, and if that area's had a lot of stress, things can not be in the right place. That's something I don't check out or anything, but I can kind of give tips and tricks if you do have known problems with prolapse or organs not sitting in the right place, or scar tissue in the area. There's things that can be worked on to make those organ area continue to function well, and also a lot of preventative advice that physical therapists with this specialty area can give. So pelvic organ support is part of what the pelvic floor does for us, including in pregnancy. That's why I do see a lot of pregnant patients. Their uterus has gotten big, the baby's getting big, things just aren't, even with the whole pelvis itself, as far as the SI joint and the lumbar spine, there's a lot of changes that go on there that I can help work with and help you not have pain during and after pregnancy as well. So that's an important aspect of pelvic health physical therapy, is our comfort in working with the prenatal and the postnatal, postpartum area. So y'all have a good Monday. I hope you learned something. Lots of information here. If you have questions, let me know or ask your doctor for more information on what's going on in your particular problem. Y'all have a good Monday.